The MARS-2 trial was patients either had chemotherapy alone and then were followed out to see whether or not they died or recurrence, versus chemotherapy first, and then you got surgery, and then they followed those patients out. And when they compared those two groups, turns out that the chemotherapy alone group, meaning no surgery at all, lived longer by several months versus the chemotherapy group followed by surgery. We wholeheartedly applaud the investigators for doing a randomized control trial, compare two groups in a blinded fashion, all of that, and to go through all that. But just to know that there's some inconsistencies with it, that we shouldn't just go based on that trial. Generally speaking, most of the data and what most of us think in the field about an expert mesothelioma surgeon is somebody that's done a lot of cases. The MARS-2 trial only really required a handful, less than 5, less than 10 cases that they've done in their career to qualify as a mesothelioma expert surgeon. This is my opinion, but most of us would say that's nowhere near enough, not even close to what you would be considered an expert surgeon. Number two, they didn't stage the patients. This was a study done over the last 10 years, and in the standard in the United Kingdom and often in Europe was not to get what we get, which is a PET scan. In North America, we always get a CT and a PET scan. The PET scan is the most sensitive and specific test to tell you if you've had distant spread. The majority of these patients were not required to get a PET scan. So essentially, they were operating on patients that were stage 3 and 4, and they included that group. Now, it wasn't all their patients, but they did include that group in their analysis. They didn't just look at epithelioid, which is kind of what we've always kind of known to do the best prognosis. They looked at all cell types. So 15 to 16% of their cases that they did for surgery were biphasic and or sarcomatoid. That's why it's really important, not just for the doctors to know, but the patients to know that, yeah, surgery can be beneficial still, and there are many of us still doing that, and many with good results. So with mesothelioma, I think it's good that you get multiple different opinions from people that know the field.